Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256, and we are going to discuss speaking tasks today. And that is the thing. That is why I included it in your curriculum. I know majorly of us, our students are nurses, but still we gave you this task today. It is one of the tasks by the Cambridge themselves. So Cambridge Box Hill has created this task. So I will go through this speaking task and will try to relate it to you. I have never in my life read this task. So मैं बिल्कुल वैसे ही पढ़ूंगा जैसे आपको पहली बार पेपर में ये टास्क मिलता, तो आप कैसे करते, बिल्कुल सेम वे में आई विल ट्राई एंड एग्जीक्यूट दिस टास्क. सो बेसिकली आप सबको ये टास्क देने का मतलब यही था, यही बताना चाहते हैं कि डॉक्टर्स और नर्सिस के टास्क में बहुत ज्यादा फर्क नहीं होता है. सो इसीलिए आज आपको डॉक्टर्स का चेंज करके यहाँ पे नर्सिस लिख के आपको दिया गया. एंड थैंक्स टू कैम्ब्रिज बॉक्सिल फॉर क्रिएटिंग दिस वंडरफुल टास्क. और ऐसा ही टास्क पेपर में आएगा. कैम्ब्रिज बॉक्सिल इज द वन जो आपके एग्जाम्स की प्रिपरेशन भी करते हैं, आपको एग्जाम प्रिपरेशन में हेल्प भी करते हैं. तो दैट बेसिक. और अगर हम अपने सेंटर्स को देखें, ओईटी के सेंटर्स को, तो वो भी कैम्ब्रिज बॉक्सिल के ही हैं, कैम्ब्रिज के ही हैं. जैसे आप ज्ञान सागर में पेपर देने जाते हो एंड ऑल दैट, तो अलग अलग एरियाज में, पुणे में भी है इनका सेंटर्स. तो ये टास्क वैसा ही है जैसे पेपर में आएगा. तो आपको सिर्फ ये पेज मिलेगा. तो आपको पेज में क्या करना है, वेदर यू आर अ नर्स और अ डॉक्टर, इट डज नॉट मेक अ बिग डिफरेंस, क्योंकि आपको टास्क अच्छे से करना है और पेशेंट को सेटिस्फाई करना है. तो अगर मैं यहाँ पे नर्स लिख देता हूँ, जो हमने आज आपके साथ किया, आपके टास्क को थोड़ा मुश्किल करने के लिए, ताकि आप अच्छे से प्रिपरेशन कर सको. तो यही है. यू इन्फॉर्म योर 42-year-old पेशेंट ऑफ हिज हर रिसेंट फास्टिंग ब्लड ग्लूकोज टेस्ट रिजल्ट. तो उसका जो रिसेंट रिजल्ट आया है, दैट इज 77.6 मिलीमोल्स पर लीटर, विच कंफर्म्स द डायग्नोसिस ऑफ डायबिटीज माइलेटस. ये डॉक्टर्स का टास्क है, तभी यहाँ पे लिखा हुआ है कि विच कंफर्म्स द डायग्नोसिस ऑफ डायबिटीज माइलेटस, क्योंकि डॉक्टर्स ही डायग्नोसिस कर सकते हैं. द टेस्ट इज पेशेंट सेकंड टेस्ट दिस मंथ. तो ये पेशेंट का सेकंड मंथ टेस्ट है इस मंथ में. द पेशेंट चैलेंजेस योर डायग्नोसिस. सो पेशेंट कहता है कि ये झूठ है, दिस इज रॉन्ग, कि मेरे को हो ही नहीं सकता. सो ब्रीफली एक्सप्लेन डायबिटीज एंड इट्स कॉजेज. तो डॉक्टर का जो सबसे पहला, या नर्सिस का जो इस टास्क में पहला काम था, वो था कॉजेज बताना. तो कॉजेज क्या हो सकते हैं, इट कैन बी जेनेटिक्स. ये तो हमें सबको पता है कि डायबिटीज इज मेजरली जेनेटिक्स. सो इवन इफ यू डोंट ईट शुगर, इट कैन स्टिल हैपन. Also, diet has a major role. Diet, exercise, there are many other factors which play a crucial role when it comes to diabetes. So it is not only sugar. So people are mistaken that it happens due to sugar only, but it is not so. It can happen due to other reasons as well. Genetics is the prime reason. And even if you are not eating sugar, it can still happen. And there are multiple factors involved, like diet, exercise, lifestyle, smoking, drinking. There can be various other reasons. तो यहाँ पे आपको ये बताना था. तो पहला पॉइंट आपको यही दिया, ब्रीफली एक्सप्लेन डायबिटीज. तो डायबिटीज इज अ कंडीशन इन विच ब्लड शुगर लेवल रिमेन्स हाई इन द बॉडी. सिंपल सी बात है. डायबिटीज का मतलब क्या है, हाई इन द बॉडी. तो सिंपल सी बात है, डायबिटीज को आप सिंपल वे में ऐसे ही बता सकते हो. एंड इट्स कॉजेज ये मैंने आपको बता दिए हैं. अगेन अगर एग्जाम में आएगा, तो मुझे लगता है अगर नर्सिस के एग्जाम में आएगा, तो पक्का यहाँ पे ये दिया होगा, डाइट, एक्सरसाइज, जेनेटिक्स, ये सब बातें आपको दी होंगी. सो यू डोंट हैव टू टेक पेन वेदर इट वुड बी गिवन और नॉट. Then second point is explain that the thresholds raised glucose levels on two occasions for the diagnosing diabetes mellitus are determined by WHO standards using evidence from the research. So basically, from the evidence collected from the research, WHO has defined that if blood glucose levels are high on two occasions, if blood glucose levels are raised on two occasions, then it confirms diagnosis of diabetes mellitus. That is why we are saying you are having diabetes, because this is the second test of this month. And in this test also, your blood glucose level is high, which is 7.6 millimoles per liter. So even the last time your blood glucose level was high. So that is why we are saying that you are being diagnosed with diabetes mellitus. And now I would like to tell you that early treatment and regular appointments for monitoring diabetes status can be really helpful. In these appointments, we will measure your sugar levels, blood pressure, and also will check your cholesterol levels on regular basis. It will help prevent the complications such as blockage of the blood vessels to the heart, brain, and feet. And also diabetes can cause problems with kidneys and eyes. So that is why it is very important to get your sugar levels monitored at regular intervals, and also we will require to monitor your diabetes status on regular basis now. So patient को आप ये बताना चाहते हो कि आपको diabetes mellitus के साथ किया है, reasons कई हो सकते हैं, then we have told you how to manage it, that basically you have to come for regular monitoring and regular appointments. Recommend dietary lifestyle changes. अगर आपको बाय चांस यहाँ पे कोजेस नहीं दिया होता तो यहाँ पे दिया हुआ है आपको कोजेस, डाइट एंड लाइफस्टाइल चेंजेस. So now we would like to talk about the diet. Yeah, you should eat less of sugary foods. If you are drinking alcohol, you need to decrease the alcohol, and also you need to do regular exercise. So more importantly, we will refer to you to a dietitian and diabetes educator who will provide the education about diabetes. Okay. So now can we commence the preventative measures as the test results are valid and further tests are necessary. So अब patient की consent लेके कहना है कि क्या हम आगे बढ़ सकते हैं. So these are the main things. आपको ये रोल प्ले मिलता है. वैसे तो देखो मैंने पेशेंट के टास्क को नहीं पढ़ा, और नर्सिस और डॉक्टर्स में अगेन यू हैव टू स्पीक वेल यार. इट्स नॉट अबाउट नर्सिस, इट्स नॉट अबाउट डॉक्टर्स, इट्स अबाउट हाउ यू स्पीक. तो मैं आपको दोबारा बोल के दिखाऊंगा, लेकिन वैसे ही देख रहे हैं हम पेशेंट को क्या दिया होता है. तो पेशेंट को दिया यू आर अ 42-year-old and your doctor has just provided you with the results of most recent fasting glucose. The test is your second test, confirms the diagnosis of diabetes. You have a limited understanding of diabetes mellitus and you know by the term sugar diabetes. You are not convinced the diagnosis barely on these two tests. तो आपको चैलेंज करने को, तो पेशेंट आपको चैलेंज करेगा, तो पेपर में वो अग्रेसिव भी हो सकता है. Oh, doctor or nurse, how can you say that I am having diabetes? I cannot have diabetes because I am not eating sugar and I have never heard of diabetes mellitus. I have always heard of sugar diabetes. That means in my knowledge, diabetes happens only due to sugar intake and I do not take any sugar. So I challenge your diagnosis. It is wrong. सो फिर आप उससे पूछोगे, डॉक्टर पूछेगा तो आपको पूछना कि, या नर्स पूछेगी कि डू यू नो अबाउट डायबिटीज? आई हैव हर्ड ऑफ डायबिटीज, इट इज सेम एज शुगर डायबिटीज. स्ट्रेस दैट यू आर नॉट कन्विंस्ड ऑफ डायग्नोसिस. तो यहीं पे वो पेशेंट आपको बार बार तंग करेगा. जब आप पेपर से वापस आते हो, सर मेरा पेशेंट मान ही नहीं रहा था, उसको कह रखा है, वो जान के आपको कहेगा नो आई एम नॉट कन्विंस्ड, यू आर रॉन्ग नर्स, यू आर नॉट डूइंग द राइट थिंग, यू आर रॉन्ग डॉक्टर, यू आर नॉट डूइंग द राइट थिंग. तो आपको उसको कन्विंस करना है. आई डू नॉट ईट शुगर, आपको बोलेगा यू ओनली डिड 2 टेस्ट. आप अभी कैसे कह सकते हो? एक्सप्लेन दैट यू डू नॉट बिलीव द डायग्नोसिस, यू आर रिलक्टेंट टू कमेंस द डॉक्टर सजेस्टेड मैनेजमेंट प्लान. तो जब आप उसको मैनेजमेंट प्लान बताओगे तो भी वो कहेगा नहीं 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 करना, और वो आपसे और टेस्ट की डिमांड करेगा और आपको रिलक्टेंटली अग्री विद द डॉक्टर. तो पेशेंट को ये कर रखा है, रिलक्टेंटली अग्री करेगा, आपसे पूरा सेटिस्फाइड नहीं होएगा. तो जब आप एग्जाम दे के आते हो, आप कहते हो सर मेरा पेशेंट सेटिस्फाई नहीं हुआ, मेरे को लग रहा है उसके एक्सप्रेशन से उसको दे रखा है कि उसने सेटिस्फाई नहीं होना. तो प्लीज आप अपनी गलती मत निकालो, आपकी गलती नहीं है, उसको दे रखा है कि सेटिस्फाई नहीं होना. तो प्लीज आप अपने टास्क को अच्छे से बोलो. तो मैं आपको दोबारा बोल के दिखा रहा हूँ अच्छे से. Good morning. My name is this. I am a nurse over here. And as your recent fasting blood glucose test shows that your blood sugar level of fasting is 7.6 millimoles per liter. So as per the doctor, you are diagnosed with diabetes mellitus type 2. Well, nurse, what is this diabetes mellitus 2? I have never heard of. Well, it is basically that you are having high sugar level, so which is known as diabetes mellitus because your 2 tests have confirmed that you are having high fasting blood glucose level. And according to WHO, if you are having raised glucose levels on 2 occasions, that means you are diagnosed with diabetes mellitus. Well, nurse, I do not have any idea about diabetes mellitus. I have heard about sugar diabetes, and that happens basically due to the intake of sugar. But I do not take any sugar. And also you have done just 2 tests. How can you say that I am having diabetes? वेल फर्स्ट ऑफ ऑल काम डाउन एंड रिलैक्स. ये बहुत इंपॉर्टेंट है, बहुत इंपॉर्टेंट है कि रोल प्ले करते करते यू गाइस फॉरगेट. दिस इज वेरी इंपॉर्टेंट. Calm down, relax. First of all, have a seat. Let me tell you that according to WHO, as I have explained earlier, that if you are having raised glucose level on 2 occasions, that means you are having diabetes mellitus. So it is not sugar diabetes, and it majorly does not happen because of the sugar. There can be other causes as well. So sugar is not the only cause. It can happen due to dietary intakes, wrong dietary intakes, having alcohol or smoking. It can also happen due to the not doing exercise every day. So there can be various factors, and majorly it is part of genetics. That means it is a disease, it is a condition which majorly happens because of hereditary factors. That means because of genes. So if your family has diabetes, then there are high chances you will have diabetes even without eating sugar. Are you getting my point? Well, nurse, I'm getting your point, but I still cannot believe, I don't know what's going on. Well, again, please try and understand that we are following the World Health Organization's protocols and standards. And according to the research, and we have taken your test and you have diabetes. So now we need to know about the early treatment. And also I need to inform you about the regular appointments for monitoring your diabetes status, that we have to regularly monitor your sugar levels, regularly monitor your blood pressures, and also we have to check your cholesterol on regular levels. So it is very important to prevent complications such as blockage of blood vessels to the heart, brain, and feet, and also to prevent the problems with kidneys and eyes. So diabetes condition can lead to various kind of problems and complications. So to prevent, regular appointments and early treatment is very important. So do you agree that we should go ahead with the treatments? Well, no, nurse, I still do not agree. Well, please understand it's important for you, and also you have to take these regular appointments. It's for your benefit only. Still, you have time to think. I will give you a leaflet which contains all the information about diabetes mellitus. You can also check over the internet to gain some more information about it. But please understand that you should now take the treatment, which is very important, as early treatment can prevent complications. Are you understanding my point? Well, yes, nurse, okay, I will try, but still I'm not pretty sure. Don't worry, we will also recommend you dietary and lifestyle changes, and will refer you to a dietitian and diabetes educator who will provide you counseling and give you education about diabetes. So whatever the confusions you are having about diabetes, those confusions would be taken care of by the diabetes educator. So diabetes educator will give you every information about it. Is it okay? Well, all right, nurse. Yes, I would like to take some information. Okay, then. Now, do you agree to commence preventative measures as these test results are valid? And there are further tests which are not, and further tests are not necessary at the moment, because these two tests are enough to say that you are having diabetes. Well, all right, nurse, if you are convincing me, then I don't know what to say, but I would like to have a counseling session. Okay, I'm referring you to a dietitian and a diabetes educator. They will counsel you. And do you have any other doubt? No? Okay, then take care of yourself. I will fix your appointment with the doctor again, and he will give you an appointment time. So please come on that appointment so as to take the preventive measures and to take early treatment. Is it all right? Okay, so here is the leaflet. It contains the information about your diabetes condition. And if you need any other information, there is a number in the leaflet. You can contact us on that number at any time. Okay, nurse, thank you. That's it. This is how you perform 5 minutes role play in this time. Reassure करना यानी कि last में summarize करना that you surely have diabetes, but it is very important to come for treatment. So I would like to tell you again, I would like to remind you, ये words बहुत जरूरी होते हैं. इस task में reassure तो जरूरी नहीं है, but I would like to remind you that you should come for the treatment. It's very important for you. So ये line बहुत important है finish करने के लिए. Please listen to this role play, whether you are a doctor or you are a nurse. Please listen to this role play at least 3-4 times. It is a very simple role play, but it teaches you a lot of lesson. If you go through this particular role play 2-3 times, being a nurse, you will learn a lot, because today we complicated your task by giving you a doctor's task. But I really wanted you that you should learn more than what is required, because this will give you an upper edge when you will take your examination. So we really want you guys to understand more, because we all want you to practice little hard stuff before you actually take your exam. So this is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. Thank you.